I'm Dr. Peter Van Houten. I'm a family physician. I've been in medical practice for approaching 30 years, and I've also been a student and practitioner of meditation for a little bit longer than that, actually close to 35 years. Interestingly enough, in the practice of medicine right now, there's a whole new approach to working with mental health and behavioral health problems. And the process that's occurring in many medical clinics, such as the one that I founded and work in, is that we've actually integrated the treatment of mental health problems right into a primary care or family practice setting. One of the exciting things that's come out of this is that many of the techniques that you've learned on this program about the use of yoga for emotional healing are exactly the techniques that we're using in our medical clinic to work with everyday patients from very typical backgrounds to work with overcoming blocks in their own emotional nature, in their own personality. For example, it's commonplace for us now to recommend affirmations or thought pattern retraining. We actually give it a fancy term, cognitive behavioral therapy, but in fact, it's the same kind of affirmations that you'll be learning on this video. Also, learning a meditation technique. In medical practice, we call this a relaxation technique or a stress management technique, but it looks very similar, or in some cases identical, to what you'll be learning on this program. Really, it's only been in the last 15 years has there been this tremendous improvement in our understanding medically about how to work with problems of need for overcoming emotional blocks or emotional problems like depression or anxiety. You know, if you look back as recently as 25 or 30 years ago, there was very much this thought in the science of medicine that it was really impossible to change your personality, impossible to change behavior patterns, even impossible to change things like a tendency toward depression, alcohol use, or anxiety once you'd reached young adult years, that during childhood and teenage years there was a time of development. You came into this life with certain genetic or inherited patterns, very much determined by who your parents were, and that you went through a developmental stage up until somewhere in your teen years, and then suddenly you reached a point at which your brain had finally finished developing, and from that point on it was largely unchangeable. And so the ability for us to give someone who was depressed or chronically anxious or was addicted to alcohol any real hope for a substantial change in their behavior was frankly pretty much limited by this concept that our brains were actually frozen by the time we were age 22 and didn't change appreciably after that. Well, fortunately, our understanding of the brain has changed dramatically. And in fact, we understand now that the brain is probably the most changeable, the most plastic organ in the body. The term we use for it in medicine is neuroplasticity. This idea that brain cells somewhere around the age of 22 or 23 are all laid down, then don't change anymore through the rest of your lifetime. This concept that we had 25, 30 years ago, and that in fact really your life was just a race between your brain dying off cell by cell and the rest of your body to see which sort of died off first, whether your body would wear out and you'd still have an active brain, or whether your brain cells would wear out and you'd be demented with a fairly healthy body. I mean, neither aspect seemed a very happy thing to think about. But what we understand now is, because there is tremendous neuroplasticity, tremendous changeability of the brain, not just in someone's 20s, 30s, and 40s, but all the way through their adult years. They've demonstrated clearly that people's brains in their 70s and 80s are still making new brain cells and are still highly changeable. In fact, one way I like to think about it is the brain really has been designed for change, and really all it's waiting for is for us to point it in the direction of how we want it to change. And we also understand there are very good tools to help the brain change. They've been well substantiated with scientific research, and much of what you're learning on this video in terms of technique to change your personality, to overcome old emotional hurts, change unhelpful emotional patterns in yourself, are exactly the same scientifically proven tools that we use in everyday medical practice now. Let's talk a little bit about the changeability of the brain more in detail, because I think this is tremendously helpful to understand, because it shows so clearly how dramatic the kinds of changes that we can see both in thought patterns, behavior, and in fact structure of the brain can occur depending on how we're using it. Now you notice I actually said change in structure. In fact, the actual physical architecture of the brain changes depending on how we're using it. If an area of the brain is not being used and suddenly we take up a new activity and that area of the brain is now being used in a new activity, there's a tremendous revolutionary change that occurs in that area of the brain. And what happens is that area of the brain that is now being emphasized has tremendously improved function, it tremendously changed actual structure and architecture as well. Let me give you an example of this. Let's say you were someone who at age 70, after a life of being only an English speaker, decided that you'd like to speak French. You'd like to go visit museums in France and be able to read and speak the language when you go. So you embark on about a 6-month project of learning this new language. Now, probably many of you over the years have heard the old wives' tale that really beyond about age 15 you can't learn a new language. Well, someone actually studied this and they found that people can learn new languages in their 70s and their 80s actually just about as well as in their 20s, 30s, or teens. But there's often just a little bit of lag, a few weeks when they first start, while their brain is literally reconfiguring and readjusting to let them take on this new activity. But if you look at 6 months down the line, that a 15-year-old and an 80-year-old can learn a new language with about the same facility. The thing that we can look at here is precisely what happens in this fellow's brain when he takes on this new process of learning a new language. Here he's learning to speak French. Well, if we actually look at the area of the brain involved, it would be the speech centers in the brain. And those are located in the left part of the brain, just sort of opposite where your ear is, in the temporal lobe of the brain. And it turns out that the moment this fellow goes out and buys his set of audio tapes so that he can listen to people speaking French, and he buys his novels in French so he can start reading French, and he finds some people that he can speak French to, when he embarks on that process, immediately the temporal lobe of his brain begins reconfiguring to allow him to do this new process, speak French, and allow him to do it with much greater facility than he has when he first starts. Literally what we'd find is that portion of the brain that's concerned with language, language acquisition, with speech, language understanding, all undergo this tremendous revolutionary change. There's actually 3 processes that happen here that are of importance. The first one is that we actually increase the number of neurons, the actual number of brain cells in that area of the brain. They've actually done a number of studies on this, and they show that when an area of the brain begins being used, it actually increases in volume. So just like when we lift weights and our muscles become bigger, literally that area of the brain that's being used more increases in volume, increases in size, because there's more neurons there, there's more brain cells there to allow you to have that new activity or new process. Second thing is, there's a process called recruitment. This is a fascinating aspect of the function of the brain, because what we see is that the brain, rather than being specific areas that have only one delineated function, for example, the area of speech in the left side of our brain, rather than the cells surrounding it having a different function and they can never do anything else, and the speech cells can only do speech-related things, it turns out the brain functions a little bit more like collections of committees. And if suddenly we need to have more brain activity to allow us to do better with speech and speech understanding, here in our example of the gentleman who's speaking French, what we find is that the brain cells in that area begin recruiting nearby brain cells that are being used in some other fashion and ask them to join the speech committee. And so they join the French-speaking committee, and so not only are there new neurons, but now there are recruited neurons that are helping out in trying to increase the ability, the actual function of that area of the brain to allow us to do that new thing. The last thing is the number of interconnections between the neurons or brain cells in that area skyrockets dramatically. If you look at a typical neuron, possibly it has 5, 10 interactions, interconnections, nerve wires between itself and the surrounding cells. When this area begins being used with tremendous new emphasis as the person is taking on learning to speak French, what we find is the number of interconnections skyrocket. They become 50, 100, a dramatic doubling, tripling, quadrupling of the number of interconnections in that area of the brain, which allow us to have much better efficiency, much better ability with speech. And in this case, the fellow is able to learn and speak French in a fairly short period of time. Within 6 months, there's been this overwhelming transformation in this area of the brain, and suddenly someone who had never spoken French in his life is actually speaking it haltingly, but he's speaking it, and he's understanding it, and he's reading it. Well, we've talked about how changeable, how plastic the brain is, this whole concept of neuroplasticity. Well, how does this apply to someone who is trying to overcome alcohol, or someone who has an inherited tendency toward depression, or has had some unfortunate things happen to them during their lifetime and they're feeling panic attacks every time they think about that, or they're feeling hemmed in some way, or trapped by some aspect of their personality that makes it difficult for them to interact with other people in the way that they'd like to? Well, the happy news is that all these aspects of our brain and nervous system that relate to personality, that relate to addictive processes, to mental health states like feeling depressed or anxious, are also changeable just in the same way we talked about the brain being changeable for something like acquiring new language. In fact, we can change the function of our brain, literally change the structure of our brain as it relates to depression, anxiety, addictive disorders, and even more basic things like our ability just to get along with other people and be cooperative when we need to be able to stand up for ourselves strongly. Now, it might seem, well, how is it possible for us to change fundamental aspects of our behavior and character? Well, the answer to that is actually twofold. One is all we have to do is start doing things that have been scientifically proven to change the brain and nervous system in such a way that allow you to overcome those tendencies. And much of what's contained in this videotape today, the actual training exercises that you're being taught here, are ones that are going to dramatically allow you to reshape your underlying brain function, your underlying brain structure, so that you can have a new type of behavior, so that you can have a new way of being that will actually make it that in some years you'll be able to look back and say, I really was that way before, but boy, that isn't part of me now. Depression isn't a part of me now. Anxiety isn't a part of me. Boy, I remember when I had trouble with alcohol, but that just isn't part of who I am anymore. Such is the power of neuroplasticity and changeability, and we're so fortunate that we have scientifically proven techniques to allow us to make structural and functional changes in our brain to overcome these negative states. I'd like to talk specifically about two areas of the brain because I think particularly in this era, people often like to understand, well, exactly how is this working? We've talked a little bit about neuroplasticity, but I'd like to talk about two specific areas of the brain because they're so important to negative emotional states, whether we want to talk about addictive disorders, depression, anxiety disorders, bipolar disorders, all of those things, even attention deficit disorder. All those things can be tracked down to inharmonies in just a few structures of the brain. And they're the key areas to understanding the way in which the brain has a specific role in mental health and behavioral health. I'm going to show you two structures in the brain now and then talk a bit about what each one does and how they interrelate, because what you'll see, again, our brain has been engineered to allow us to change. And we understand a lot now about how these specific areas interact to give us tremendous ability to change our personality, to change our tendency toward addictive disorders, to overcome depression, anxiety, and other negative states. I'm going to pick up my brain model now. Now, this is a brain model that's about the size of a 3-year-old's brain. I actually didn't get the larger one because it was much more expensive. And you can see everything on this. Now, what I'd like to show you here, now I've oriented this about the way my brain is oriented. My eyes would be right about here where my fingers are. And this would be my forehead here, right where I'm tapping, just this area right here. And I'm going to turn the brain forward now. And what you can see, this first 1.5 or 2 inches of the brain right behind my forehead is the area of the prefrontal lobes of the brain. The prefrontal lobes are extremely important to our everyday function, to our personality, to how happy we are, our ability to go through stressful situations and maintain equanimity and calmness. Now, there's one other structure I'd like to show you, and I'm actually going to dismantle the brain with you watching so you can see where this is located. I'm taking off the outer part of the brain, and I'm holding the brain up again, just as I was holding it before, with all the outer structures gone. Down here is the spinal cord. And these two ram's horn shaped structures here that look sort of like half moons are called the limbic system. And literally they're called the limbic system because each one of these half moon shaped structures is a limbus. It's kind of a whimsical name, but in fact that's exactly what it's called, the limbic system. We talked earlier about the prefrontal lobes, and I'm going to start talking more about them in detail, and then we're going to talk about the limbic system and how it relates to the prefrontal lobes and our day-to-day function. The prefrontal lobes are the most refined part of our neuroanatomy. That is, when you look at the part of our brain that's concerned with our highest intellectual and human functions, many of them are focused in the prefrontal lobes, or the prefrontal lobes are key in our ability to have those functions. For example, our ability to concentrate on a topic and stay focused on it and persist with a task is a prefrontal lobe function. Our ability to learn new information, even though other areas of the brain are concerned with memory, the prefrontal lobes are very key in our ability to take new information in and appropriately lay it down in our brain so that we remember it. One of the things we've begun to understand, for example, about attention deficit disorder is that children and adults who have this actually have a problem with their prefrontal lobes powering down or switching off when they go to learn something. And so instead of their prefrontal lobes revving up and working better to allow them to learn things, paradoxically, they switch off, and so they're unable to learn new things. You can understand the frustration of someone with attention deficit disorder, because right when they need to learn something, the input valve to their learning mechanism closes itself off. Again, one of the key features of the prefrontal lobes is their function in learning. The same with creative expression. Prefrontal lobes are key in creativity, even though other areas of the brain are also involved in creative thought, depending on whether it's music or the visual arts or the written arts. Other areas can be involved, but active and harmoniously acting prefrontal lobes are key for our ability to express that creativity. Our ability to feel upbeat and cheerful is a prefrontal lobe function. In fact, you see that in people who are depressed, is that if you do a scan on their brain, what you find is that their prefrontal lobes are very quiet, they're silent, and after they've gone through therapy, whether it's a talk therapy or a medication or the kind of training that you're receiving in this video, and their depression lifts, you find that their prefrontal lobes become active once again. And that activity is directly related to how they feel. Our sense of humor is a prefrontal lobe function, and people who have damaged prefrontal lobes actually have trouble understanding a joke or why it's funny or laughing. One of the things you often find with people with robust, highly active prefrontal lobes is that they often have a very good sense of humor. Our ability to get along with others, to cooperate with others, is a prefrontal lobe function. I think what you're seeing here is that very much the characteristics that make us adult and highly functional human beings are prefrontal lobe functions. And what we're going to look at now is the limbic system and the kinds of patterns that it introduces into our behavior and how the prefrontal lobes and limbic system interact, because it's very key. And lastly, we'll look at how the exercises that you're learning on this video are going to be helpful in restoring a healthy balance between the limbic system and the prefrontal lobes. The limbic system is a very primitive part of our neuroanatomy. I'm calling it primitive because if you look at a rabbit, if you look at a crocodile, as well as a human being, they all have limbic systems just like we do. If you look at a rabbit, he has hardly any prefrontal lobes at all, and a crocodile has even less. So this prefrontal lobe part of us that is characteristic of us being human is not found in these lower animals, and yet even in a reptile like a crocodile, you can find very robust limbic system tissue that looks a whole lot like ours. Well, it turns out the limbic system is that portion of our brain that's concerned with strong emotions and instinctual behaviors. Well, one thing you can be sure of is if you look at someone who's out of control with anger, or if you look at someone who is very depressed or highly anxious or in a panic attack, if you could scan their brain right at that moment, what you'd find is that their prefrontal lobes are very quiet, almost silent, but their limbic system is overpowered, over-revved. All the energy, all the activity in their brain is focused in this very primitive part of their brain. And so what do? We get a very primitive kind of behavior. One of the things that has come out of brain studies of the last 15 to 20 years is that there's a very key balance between the prefrontal lobes and the limbic system. It's almost as though our limbic system was designed as a safety net, that it gives us basic emotional functions, even if they're negative. It gives us instinctual behaviors, you know, the kind of thing where you know enough to get out of the rain and reproduce and eat. Very simple things, but all are truly human behaviors and superhuman behaviors. All are altruistic drives, all are ability for spiritual endeavor and development are all prefrontal lobe functions. And the way we've been designed is that the stronger our prefrontal lobes become in function, automatically there's an inhibition of the limbic system. And this isn't a suppressive kind of thing. This is just an automatic, very natural evolution of the brain realizing it doesn't need these negative manifestations of behavior to protect itself, that the prefrontal lobes, in fact, are in charge. And all these very positive aspects of the prefrontal lobe are the way we live. You can actually call it living superconsciously, not just consciously, living superconsciously in the prefrontal lobes of the brain, whereas the limbic system is this very primitive, almost subconscious part of our brain. So this development of overcoming the functions of the limbic system, this part of our brain that is so concerned with very primitive behaviors. And again, just look at someone who is in a panic attack, someone who is driven by addictive behaviors, someone who's just depressed. You can be sure that their limbic system is emphasized and overactive. Now, the happy news is there are alternatives to being stuck in that limbic system miasma or morass. And basically, the fact that the brain is so eminently trainable. Again, remember this whole understanding we have now that the brain is very changeable, it's very plastic. We can take advantage of neuroplasticity, neurochangeability, to change the function of the limbic system and to awaken and emphasize the prefrontal lobes. And then automatically the prefrontal lobes help keep the limbic system behaviors in check. Now, we've known for years that people with panic attacks and anxiety disorders and phobias can be trained to overcome those things. And the kind of techniques that you're being taught on this videotape are exactly the kinds of things we use in medicine to help people overcome unhelpful behaviors. Again, we give it more technical terms. Again, affirmation becomes cognitive behavioral therapy, where we're giving people new thought forms, new thought patterns to use, but basically it's the same technique, individualized for that patient. Again, when you look at meditative techniques where we're drawing on the neuroplasticity of the brain to change in very positive directions, we can find that when people meditate deeply, the part of the brain that gets emphasized is the prefrontal lobes. In fact, I've had patients ask me, well, you've explained all this to me about how important the prefrontal lobes are. Well, how do I get in there and change them? The simple answer is, do the processes we've already given you. When you meditate deeply, automatically your energy, your focus, your emphasis gets shifted to the prefrontal lobes, calming the limbic system, calming this primitive part of ourselves, emphasizing these much higher, more refined functions. The more we meditate, the more we do these refined practices, we find that the prefrontal lobes become predominant and the limbic system automatically becomes quieter, automatically is clamoring less in the background, trying to take center stage. It's actually quite content to be quiet when it's not needed. I think the last thing I'd like to say about this is that there is so much ability for neurological, structural, and functional change in the brain that really the only thing someone needs to do with these kinds of exercises is really to persist with them. Because if you do them on a regular basis, and usually I tell people you need to work at least 1 to 2 months before you expect much change, and plan to spend at least 6 months doing them with some regularity, because that's about how long it takes to set these changes in place so that they're actually there and will be self-sustaining in a way that they won't automatically slip back the moment that you stop doing them. Any of the techniques that you've been taught on this videotape will actually be beneficial to you even if you did them lifelong, and you will continue to make progress and change. The thing I've always been most impressed about the brain's ability for change is, in a sense, it's really infinite, it's really endless. And so once you start feeling better, where your depression is better, your anxiety has been calmed down, your ability to cooperate with others is better, your tendency toward addictive behaviors has begun to calm down, don't feel you have to stop there. You can keep emphasizing your prefrontal lobes and drawing these tremendously positive behaviors, things that you probably didn't even realize you had as part of your divine birthright, and have those become the emphasis in your personality simply by developing these prefrontal lobe functions. And again, it doesn't have to be anything highly complicated or difficult or demand years and years of therapy. The very simple exercises that you're being taught here, if done with enthusiasm and done with persistence, will offer you a tremendous amount of change, and I can't recommend them highly enough.